Greetings, this is Zidong Yang from the Laboratory of Functional fMRI Technology at University of Southern California. Today, I'm going to present changes in vessel density in genetic cerebral small vessel disease, CADASIL, revealed by high-resolution blood MRI, a pilot study.
I have nothing to disclose.
The world population is rapidly aging. Alongside this rapid growth comes a great burden of dementia. Vascular contributions to cognitive impairments and dementia in the elderly have recently received a lot of attention, with cerebral small vessel disease, often termed CSVD, increasingly recognized as the major contributor of age-dependent dementia and stroke cases. Cerebral small vessel disease is an umbrella term for complex conditions affecting blood vessels, especially small vessels of around 50 to 500 microns in diameter. It affects around 5% of people over 50 years of age and drastically increases to 100% of people over 90. Common image findings include white matter hyperintensities on FLAIR images, lacunar stroke, enlarged perivascular spaces, subcortical and cortical hemorrhages, and etc. Although an extensive study, the underlying mechanisms of CSVD are poorly understood. In essence, the diagnosis, prevention, and understanding of the disease lead to an increasing requirement of reliable, accessible, and quantitative imaging analysis methods. In this first study, we focus on a specific subtype of CSVD called cerebral autosomal dominant arteriolopathy with subcortical infarct and leukoencephalopathy, or CADASIL, which is the most prevalent form of genetic CSVD caused by Notch3 gene mutation. CADASIL is commonly studied using time-of-flight MRA, which is sometimes referred to as cerebral MRA. It was shown that top MRA 70 who visualize small vessels, as we can see here in this figure. However, the limited ability to delineate finer vascular structures and prolonged scan time at lower field strengths, including 1.5T and 3T, both of which are the most commonly used in clinical settings, has impeded understanding into the complex nature of the disease. In contrast, it was shown that blood MRA could reveal fine vascular structures at 3T with a scan time a bit more than just 7 minutes, and if we compare the resulting images, we can see more small vessels at 3T blood MRA than 7T TOF. Here, we present a pilot study using our novel high-resolution blood MRA at 3T, which has great clinical accessibility, in combination with our analysis pipeline to investigate changes in small vessel density in genetic cerebral small vessel disease, or CADASIL. Our data were acquired with the Siemens 3T Prisma scanner with a 64-channel head coil. The imaging protocol included a 3D MPRAGE and a blood MRA acquired using T1 ready turbospan echo with a variable flip angle sequence. The dephasing of the flowing spans along the long echo train gives us the black-blood contrast. In summary, we achieved at 3T 0.5mm isotropic spatial resolution with near whole brain coverage, with a scan time of just 7 minutes and 23 seconds. The resulting images were then pre-processed with our novel 3D analysis pipeline. To be specific, the blood images were bias-corrected and denoised using non-local means filters, and then vessels were segmented using German Western's filter. To result in our final segmentation of small vessels, the superficial veins, dural sinuses, and the middle cerebral artery were removed using the ASEG map from the free surface software. To allow for voxel-wise analysis of the spatial localization of small vessels across the patients and healthy controls, the resulting small vessel masks were convolved with the 3D average kernel to resulting in our vessel density images, or VDI. The vessel density images are then resampled to the standard MRI space, following the processes shown in the red figure to enable comparison of the patients and the controls. In this current study, 10 genetically confirmed CADASIL patients and 10 healthy controls were involved, but due to poor image quality, 1 patient and 1 control was removed from our final analysis. The patient demographics information can be seen in Table 1. As we can see here, both groups are generally young, and no differences were found between 2 groups in age, sex, years of education. The patient group, however, showed a slightly lower MoCA score. In this current study, 2 analyses were performed. First, vessel density, calculated as vessel volume over total volume ROI, were compared in the whole brain, cortical gray matter, and cortical white matter, and the hippocampus due to their relevance in CSVD. Then, Wilks-Wise analysis of the spatial localization with small vessels was also performed. Here in this figure, we show 3D rendering of segmented small vessels in 3 representative CADASIL patients and 3 healthy controls. In general, 2 patients showed reduced vessels in the frontal regions visually. This left figure shows the result of 2 sample t-test vessel density in the 4 ROIs. As a result, significantly higher vessel density were found in the hippocampus of the healthy controls compared to the patients. And although the differences did not reach statistical significance, higher vessel density were also found in the gray matter and the whole brain. Interestingly, significantly lower vessel density were found in the cortical white matter of the healthy controls, presumably attributable to the compensatory vessel dilation in the CADASIL patients, which is oftentimes reported in literatures. The right figure displays the Wilks-Wise statistical results comparing healthy control and CADASIL patients. The Wilks-Wise t-values suggested for agent X are projected onto the MNI-152 surface atlas for realization of the quantitative results. As we can see here, the differences are the most pronounced in bilateral superior temporal gyri, parahippocampal gyri, corpus callosum, cingulate gyrus, thalamus, right pericentral gyrus, right middle temporal gyrus, and left hippocampus, which are consistent with the reported neurological deficits and structural changes of the brain in CADASIL. Caveats, though, are warranted. The differences did not survive FDR correction, presumably due to the limited statistical power given a small sample size. To the best of our knowledge, this is the very first study that evaluated changes in cerebral small vessel density in CADASIL using high-resolution blood-brain MRI and a novel processing pipeline. The results suggest that a high-resolution blood-brain MRI combined with a novel processing pipeline is a promising tool for the visualization of small vessels in the brain, which will contribute to a more intuitive assessment of cerebral small vessel damage and the severity of CADASIL. We hope our techniques will eventually lead to a betterment of the care for the patients in danger of cognitive impairments related to CSVD. I want to extend a heartfelt thank you to each member of my lab and my friends for the support and assistance in preparing for the event. I'm very grateful to be a part of such a supportive and talented group and an awesome project. I also thank NIH for funding the study. Thank you.